So today we are going to talk about Scrofoloso number 2. Yesterday we talked about Scrofoloso number 1. So small revision when you will start S1, S2. Okay. So basically S1 is digestive remedy, functional remedy, and as well as S group is functional remedy and as well as curing remedy. Okay. It had 9 plants. Okay. And the 9 plants when Dr. Counts is a Metai want to prepare the S1, so he basically think that it will work on every segment of stomach. Okay, because in the abdomen we have 9 segments, so S1 will work on whole digestive system. Okay, and as well as glands. So what are the glands? Like pituitary gland, thyroid gland, thymus gland, liver, adrenal gland, etc. So basically, S1 and Ven1 is the best combination for all hereditary problems. Okay, so but we want to know the temperament of the patient to get the satisfactory results. Okay, so the lymphatic temperament will work wonderful. It will work on lymphatic temperament wonderful. Okay, so it will give best results. And second thing is that we can use S1 with along F1, Ver1, L1, and A3. So when we study the other remedies, you will get to know the main specific function along with other remedies. Okay, and the group, which group remedies are best will work with combination. Along with S1, you can give L1, Ver1, A3, F1. Okay, but other remedies, when you divide and you will give second remedy, okay, which group remedy is the best? Along with S1, you can add C1, C5, C10, C13, and C15. Okay, so I hope you understood. This is the small recap. Now we will talk about S2. So let's talk about S2. S2 means Scrofoloso number 2. So basically this is called glandular remedy. What is the name is given? Glandular. So in the body, wherever we have glands, it will work wonderful. Okay. And second, it is also called female remedy. What the name is given? Female remedy. Okay. Female remedy and glandular remedy. Okay. And you have to remember that in the S1 we have 9 plants. Okay. And the main plant is Naxomica. Okay. But here in the S2 also we have 9 plants. Okay. The other plants are same. When compared to S1, they are the plants are same. Cochlearia officinalis, Hydrastis canadensis, Nastatium officinalis, Scrophularia nodosa, Similax medica, okay, Tassilago furfura, Veronica officinalis, Matricaria chamomilla. But one plant is removed from S1, okay, that is Naxomica, and in that place, Dr. Count putted which plant? Lycopodium or Lycopodium clavatum. So this is the replacement of the plant with Lycopodium. Okay. So then the functions also changed. Okay, when you replace the plant, then the function, the uses of the remedy also changed. So then there's the reason it will purely work on glands, purely works on glands. So what are the glands are present in our body? Thyroid gland, okay, and pituitary gland, okay, okay, and we have thymus gland, okay, and renal gland or adrenal gland, okay, and pancreas, okay, and spleen, okay, and liver. So these are the main glands in the body, okay. You can see this image, you will understood easily, okay. You can see this. We have glands, hypothalamus, pituitary, okay, thyroid gland here, thymus gland here, and we have adrenal gland on above the kidney. Okay, other than that, we have spleen, pancreas, this is the liver. So other than that, the another function of S2, okay, what is the another function of S2? Let's see that now. That is, it will also named as female remedy. Means it will wonderfully work on reproductive organs of female. What are the reproductive organs? Like uterus, okay, ovaries, okay. So these are the reproductive organs of female. So you can see that this is the reproductive organs or female. This is the wonderful remedy for them. It will help to cure the problems within the reproductive system of female. Okay, so it will work on glands, it will work on female reproductive organs. Okay, this is the base of this remedy. And the another one thing you have to remember that where S1 doesn't give a satisfactory results, in that place you can add S2 because S1 is mainly designed to treat digestive system issues, where S2 digestive system issues and as well as glands. But S2 is mainly designed to treat glandular disorders. Nowadays, what are the glandular disorders are there? Thyroid, hypothyroid, hyperthyroid, pituitary gland tumors, okay? And you have another problems like pancreatitis, and you have diabetes. Okay, all these are glandular issues. The glands which are not doing their functions properly. So that's the reason S group is named as functional remedy and second curing remedy. So whenever a disease is related to glands or female reproductive organs, so we have to select S2. Okay, so S2 is the best remedy for all these organs or glands. Okay, another thing you have to remember that which remedy is best with along with S2. So along with S2, the best remedy you can select is C2, okay, and C15 from the C group, you have C2 and C15. It is best along with S2 and along with S2, you have F1 and L1. This is also good, very good remedy along with S2. Along with S2, we have another remedy that is also C10. Okay, from the C group, C2, C10, C15. And if you want to treat the hereditary problems regarding to glandular issues, you can add Ven1. Okay, like whole any type of hereditary problems, you can add S1, Ven1. But glandular issues or reproductive issues that is coming from the family tree, generation to generation, you can add S2 with Ven1. Actually, very good, give satisfactory results. Okay, and along with which electricities you have to select. You have to select PE, very good for to improve the function of S2. Along with you can use WE, and next is GE. But mostly we use BE along with S2. So kindly remember these things. When you make protocol, then it will help you. BE, because glands are secreting lymph. Glands are secreting lymphs. So the organs are lymphatic organs. All the glands are lymphatic organs, lymph production organs, lymph produced or lymph factory organs. So basically, they need circulation. Basically, they need circulation. If there is improper circulation in lymphatic or lymphatic temperament patients doesn't have proper circulation because their lymph is active. Lymph are predominance, lymphatic organs, lymphatic utilization, lymphatic uh, purification are active, but circulation is poor. So with the help of BE, you can improve the circulation as well as, and with the help of S2, you can improve the gland functions. So both will help you to treat the disease. So this is the very important point you had to note down. So BE, you have to select mostly uh, BE is used along with S2, okay, in glandular or reproductive problems like you have in the nowadays in the female we have PCOD, cyst, okay, cystitis, okay, all these problems are common, okay, and we have endometrial tumor, all these are problems are common nowadays. So now you can use BE, which will give definitely good results. And another thing, you can have to select C2, the another from the another group, you have to select C2, C10, C15. If there is an issue of a nervous issue, you can add F1. If there is an issue of lymph, here the glands are not producing good amount of lymph. S2 will improve, but they are producing the lymph, but lymphatic channels are disturbed. The traveling, the utilization of lymph is not happening properly. So which remedy you have to select? You have to select S1. So now you make the one simple formula S2L1B. So S2 for glandular function, SL1 which will improve the circulation utilization of lymph, and BE for proper circulation to the glandular organs. This is the one simple remedy, simple formula you make down. Next, you can select F1. If there are nervous issues, the circulation is good, the glands are working properly, but from the brain, the pulse are not properly given to the organs. So, okay, then which remedy you have to select? You have to select F1. Okay, so likewise, we make protocols. Okay, so this is the simple thing I discussed here. So you can select Ven1 along with S2 if there is family hereditary disorders. The mother have hypothyroid, the coming their daughter have hypothyroid, and maybe the coming generation will have hypothyroid. So what you have to give? You have to S2 Ven1, S2 Ven1. So which will improve the hereditary problems, and it will maybe stop for coming generation the same problems. Okay, so this is the very, very good remedy along with manual. So I think you understood about S2. Now we will talk about S3. Okay, if any doubts with S2, please clarify between 1 to 2 minutes.
So for C5, you said C2, C5, C10, C15. Is all this for which purpose, sir?
C2, C15, C10.
C10, yes, yes.
Basically, they we will talk in canceroso group. Okay. Here, F1, L1, I explained due to this is the lymphatic issues. So that's the reason I explained L1. F1, if there is any problem regarding nervous system, so you can add F1. Okay. So I simply explain one step here, not completely. We can talk here about C2, C10, C15. We will talk in canceroso topic. Okay. Now we will talk about S3. So S3, very important. Like S2 will work on glandular organs. Now S3 is named as urogenital problems. S3 you can give urogenital problems, or it is called urogenital remedy. What you named? Urogenital remedy or urogenital remedy. And the other is, this is the male remedy. That is, say S2 is female remedy. It is male remedy. S2 also given in for conceiving, okay, for in pregnancy, okay, for normal delivery also, okay, S2 also be used in uh, those problems. Now we will talk about S3. S3 is named as urogenital problems. What are the urogenital organs? Let's see that. We can see that we have kidney, okay, we have ureter, we have bladder, we have urethra. So all these organs are named as urogenital organs. Okay. So S3 will work in this area wonderfully. Okay. And the plants are used in the S3 are same which are used in the S1, but one plant is replaced. What are the name? Which is the plant? Nux vomica. In the place of Nux vomica, here we use Rhythm palmatum. Which plant used? Rhythm palmatum. Okay, this plant is used. They have palmatum used in the place of Nux vomica. And other 8 plants are same. So how many plants here we have? 9 plants again. What are those? Cochlearia officinalis, Hydrastis canadensis, Nasturtium officinalis, Scrofolosa nodosa, Similax medica, Tassilaco furfura, Veronica officinalis, Matricaria chamomilla, and Rhythm palmatum. So this is the very important remedy which is added in S3 remedy. Okay, so it is worked on urogenital organs, and it is also named as male remedy. And the third function is it is also used in mucous membrane. Where it is used? Mucous membrane. Mucous membranes. So let's see the things which are present in the mucous membrane. And here we have the excretory system, kidney, ureter, urinary bladder, and urethra. And we have mucous membrane. So what included in mucous membrane? We have mouth. In the mouth, we have mucous membrane. Like number of patients have stomatitis, and they have dry mouth. Okay, and they have uh, swelling in the mouth, redness in the mouth. So you can use S3. And they have nose issues. Okay, like in the sinusitis, the mucous membrane is inflamed. So you can use S3 where it was work wonderful. Okay, and they have eyelid. Eyelid is also covered by mucous membrane. You can use their S3. And in the trachea, is any issue in the trachea, you can use S3. In the lungs, you can use any problem is there, you can use S3. And stomach lining, like we have ulcer, okay, or we have in the esophagitis, gastritis, you can use S3, which is reduce the inflammation in the mucous membrane. And you have urethritis, okay, burning in the urinary tract, you can use S3. Burning in the small intestine, there is a duodenal ulcer, okay, any type of burning in the stomach, you can use S3. So basically, it is wonderful remedy for mucous membrane. So from the nose to the anus, the lining is covered with mucous membrane itself. And in the respiratory system, we have mucous membrane. In the excretory system, we have mucous membrane. Simple thing. You have to remember digestive system, urinary system, and respiratory system. They are covered. Their lining is covered by mucous membrane, where you can use S3. And the second thing you have to remember, it is wonderful remedy for genital, which are male genital. So it will work on impotency. It will work on premature ejaculation. Okay, you if you want to increase the sperm quality, sperm count, you can use S3. So S3 is the basically it will work on three things. First is urogenital excretory system. Second is mucous membrane, and third one is male organs, male reproductive organs. Okay, these three things you have to remember. So very important thing. Now you can see that which remedies are best you can use with along with S3. S3, it will work on, it will work with C3, it will work with C10, it will work with C15, and the and electricities which are best to use with along with S3 is RE and GE and WE. So these are the best electricities which are used. Mostly in case of mucous membrane issues, okay, you can use WE. You can use GE when you have uh, excretory issues, respiratory issues, you can use GE. When you have impotency, male reproductive organs issues, you can use S3 with RA. Okay. Which group in cancer also, which remedy you have to select? You have to select from this three. S3, you can select C3. From S3, you can select C10. From S3, you can select C15. So it will give you wonderful results. So today we talked about S2 and S3. In S2, very good remedy, okay, for uh, glandular organs and female reproductive organs. Okay. And S3, it will wonderfully work on urogenital issues. Okay. And along with it will work on mucous membrane. Along with it will work on male reproductive organs. Okay. So I hope you understood today's lecture. So tomorrow or in coming classes, we will talk about other remedies, S5, S6. Okay. Any doubts? Please ask.